because Dr. Brincat is not only a chiropractor and has been a chiropractor for 30 years, so incredible fund of knowledge when it comes to the spine, spinal cord, nerves, all of that, but also maps the brain. So he is very much into neural activity, what's going on in the brain, what is affecting the brain. And he's going to be bringing some information to us tonight about how our products, in his experience, affect the brain and the brain activity. I've seen some of it. Some of you have seen it as well. He's on realredoxresults.com. It's number 154. Just absolutely fascinating what he's going to be sharing with us. So Dr. Brincat from Naples, Florida, come.
He said, I am a chiropractor. I've always specialized in brain and spinal health and trauma. And unfortunately, I got into an accident myself and left me disabled for many years. I've been out of my chair for 11 years. And I say that I'm pain-free, but it takes a few hours of therapy every morning to maintain this ability out of my chair and feeling good. And it's usually towards the end of the day, hands and feet start really lighting up on me, and neck and so forth. And so over the years, I have learned that 16 ounces of Asea each day, I go 24 hours without any discomfort. If I drop it or I go on vacation and I don't bring it, and I only have the gel with me or what have you, I have about 12 to 24 hours before I literally start to fall apart. So it has been such a cornerstone of my existence back from the dead, let's just say, and able to love and serve on people like I always did before. When I got this product, I had been traveling for 2 days. I've been on the planes and layovers and all these things, and I wasn't feeling good. I'm usually pretty good during the day. It's at nighttime that things will start to wear off. But this was like 11 o'clock in the morning, and I was probably a pain level 7. And so, not my typical 9 or 10, but it was annoying enough that I'm here and I can't wait to try this. When are they going to give it to us? I really need to do it. Honestly, I put a size of a pea on my finger, and then I tucked my chin to open up my spine so I knew I would get it into the spine there. And I just rubbed it on there, and within less than 2 minutes, it was gone. And it didn't come back for 3.5 days. And I'm like, this is crazy. What is it doing? Like, we know it's the nerve, the NRF2 gene, inflammation oxidation pathway. And I know that it's doing that, but it was like, I didn't have to drink 16 ounces and I just did this little dab. Now, granted, I tried to see if how long I could go without drinking it. And after about a week, the gold wasn't even working for me. So it's like you have to maintain the cells of your body. And then this is that extra, and it's not so much all the function of the cells you're putting on. It's just trying to get the inflammation out so the body can then kick in the restore process and the rejuvenation process. So this was tremendous. So as soon as I got home, I started grabbing patients and doing my own little review. So this isn't an independent clinical study that's been published. This is just my review. I took a handful of patients. So there was the first 5 people. I did the same thing that I did with me, only I put it on the brain stem at the top of the back of the neck rather than at the area where I was having issues. And I waited 15 minutes and I mapped it again. I was certain that we were going to see some changes, and not a lot of things don't change the brain for the better. Let me just tell you, sometimes things need to stir things up before we see it get better. But when we see things that have a very profound impact on the brain, I get really excited. Like we've always said, your body, with you making redox, is 2 reasons: bring the body to homeostasis and then heal. But all the energy is going to work at keeping you in your vital signs first before it spends a whole lot of extra energy overcoming an old injury. And so the longer we can stay in that sweet place, we have so much resilience. We got all this extra workers in there doing the healing. So here's what I found when we started looking at the gold. To see how this software can reconstruct the brain. And so the cortex is the outer part of our brain that you're seeing on the top image here. And this can process information at each little crumb size of brain tissue to the tune of about 2,000 bits of data per second. Now, the white matter inside, much more sophisticated, it's myelinated. It's going to process about 400 million bits of data per second. So it's super exciting when we see how much information can be processed. Now we understand why our human brain is only 2% of our body weight, but it takes 20% of our blood to keep it from overheating. We have so much energy being created in our brain, and it's so necessary that we keep our information being able to communicate. You know, it's that cascading effect of these redox molecules throughout your brain, how they communicate. And remember, a brain cell, it just has one function and one function only: send information until you have no charge left. Kind of like our cell phones. I'm going to get on it in the morning, I'm going to use it all day, and I'm going to talk to that very last second when the battery dies. And then I charge it when I go to bed again. Well, that's what your brain cells do. When you're sleeping, they're recharging. So now we're going to see what does that look like when we see the introduction of REDOXGold. So we did a 15-minute window. That was it. And so these next images, we were able to reconstruct the entire group as one. So the left image is all 5 people, what they all had in common. They all have this presentation in common. And then after was the right image. And so much like MRIs that you can slice from the top down, from side to side, or from front to back, you can see the different color tissues. Now, everything is supposed to be green. If it's yellow, it's 2 deviations too fast. And when it turns red, it's 4 deviations too fast. So that's indicative of inflammation, okay? Too much blood going through there, too much nerve activity happening. And more is not better. It's bombarding those signals. On the other side of that, the light blue is 2 deviations too slow and delayed, and the dark blue is 4 or more. So when we look at just the outside of the cortex, we see a lot of red and yellow on the top. For everybody had this common inflammation. And then immediately after, a pea-sized dab of gold on the brainstem, within 15 minutes, all that inflammation is gone. You can see the side view, all the red in the top, and the red is absent. All the yellow and red here, and it's more green as well, and even in the back. So that's their nighttime brain. Their daytime brain, it was better to begin with, not quite as much red, but we certainly see more green at the end of it all. And then we go and look at eyes open. So this is daytime brain. Now, whenever we see blue, we're obviously more concerned because it's too slow. And we don't know if we can wake it up. We can always calm down a faster brain. But again, all this red at the top of that cortex is all gone. We see blue here, a lot more dark blue than there. And then that was right and left side of the brain. Okay. All right. So then we look at this. Now, this is called Brodmann areas. So much like you're looking at the map of the United States, and every state has its own unique shape and border. Well, you have 88 of these regions on both sides of your brain, and each one control a very specific neurological function. And so the number of the Brodmann area is along the left, and each one you could look up and see what that area controls. For instance, number 8 is muscle learning, laughter, smiling, executive control, speech programs, generating sentences in your brain, all of that. And so the absolute difference was a whole deviation away back towards normal. So they all had this in common, and they all had this result as a group, which is quite incredible because the whole group was only about 2.5 deviations outside of normal. And in 15 minutes, it brought it a whole deviation back. So that was great. That was eyes closed. And then eyes open was very similar, but it was a little over 0.65 of a deviation. So it was a little bit less than the full deviation. But again, to see this much change, now typically to put this into context, to take that much change, we would be doing 10 to 20 hours of neurofeedback. Now granted, that change would be permanent. This is going to last a few hours and then slowly start to go back to where it was. But this will initiate that healing process to happen. And so for me personally, what I noticed is that 7 that I mentioned earlier on my scale of discomfort, within 2 minutes, it was gone. Within 15 minutes, I still felt a little something in my neck, so I put a little extra on at that point. And then it was 3.5 days later when it came back, and it came back to like a 4. So I've noticed considerable changes, that some healing definitely took place because I didn't come back to the same place that I was.
Hey,
So
Mark.
with these, yes.
Mark, are these people drinking the molecules as well, or is this just gold by itself?
No, these were people that weren't introduced to Asea yet. So
Or
this
not?
was just the first time that they ever got experience to redox.
Wow. Okay.
Yeah.
Amazing.
Great question, though. Good question.
Thank you.
When we look at networks in the brain, so we mentioned we have 88 of these regions. These are little purple dots throughout that side of the brain. And think of a network in the brain like a group text. And you got 10 of your friends, you're all texting. And if you see a line show up in the picture, that means that one person blocked another person. And you thought everybody was getting the information. So ideally, there shouldn't be any lines here, just a bunch of purple dots, if the mood network was online and working like it should, neurologically. So the more lines there are, the more apt that person is to be having issues with their mood. And so we can see, is this neurological or is it psychological? If it's psychological, it's not going to be all these lines here. It's going to have the symptom, but it's not neurologically based. So when we see this, we can understand why the person's behaving or acting a certain way, because the network is telling him that's how it feels. Okay, basically it's dictating that. So as we clear, so you see the density of lines here, and within 15 minutes, over half those lines are gone. And a lot of the yellow ones, which are here, but the orange and redder ones are gone. So that is an incredible amount of change for somebody's mood in just a few seconds. The pain network. Okay, we know that it alleviates discomfort, but there's an actual network in the brain that if it's offline, you get pain over little things, where somebody else has a high pain threshold. That means that their network's online, and it takes a lot to knock it off to make me feel constant pain. Now, granted, a new injury, you'll feel that for a bit as well. Now, anxiety network, we also see this improve. Now, we're not saying that this is for anxiety. We're not trying to treat a condition. We're saying that when you can take inflammation down in the brain, the networks in the brain that have been trying to talk to each other can now hear each other again. And they start coming back online and turning to homeostasis. I mean, that's what your brain wants. It just needs a little help doing it. There's also networks for headaches and migraines. And so not that these people suffered from them, but again, we're seeing improvement in the network. So that is actually very exciting to us. And so these molecules, like I said, this is my alpha product. This is something that can set the stage for an incredible speed of healing that's going to happen inside of you. I, being a chiropractor and a specialist in the nervous system and dealing with trauma, lots of car accident patients and all sorts of different types of trauma, but we do a lot of treatments and then we wait for the body to catch up. And you're like, oh, the nerves take a long time to grow. You have the most mitochondria, they're the most complex, versus your gut cells. A couple hours, we can replace that. That's easy. Nerve cells take a long time. I have never in my life, in all 30 years of practicing, seen something that could increase the speed of nerve healing. And it's really not doing that. It's just giving you more potential so your body can respond faster and it can do more in the job that it does. We know from the studies that we've seen that if you have a healthy cell and give it some of the gold, it improves 70% more function of that glutathione. And then if the cell was distressed and damaged, it was like 280% more. So your machines have the ability to turn up more when it's absolutely necessary, but it also knows that I'm not going to turn it up and leave it in the red RPMs and adapt to that, because then I'll burn out and everything will shut down. And so it needs to have variables. And if you don't have enough redox potential, your organs and your cells are not sending signals to your brain telling you, you know what, you've been going full speed for a while. I think you should take a break and have a few breaths, go for a walk, have some water, and then get back to it again. If you're not getting the signals, your body will adapt with you. This is called general adaptation syndrome. And it adapts with you and says, oh, Mark says it's okay to keep working 12, 15 hours a day after day after day. We've been trying to signal him to slow down. He's not listening. So let's just adapt and not send him the signal anymore. And we'll run with him, until you just drop dead. So you have to understand that your body needs fluctuations. And when we start putting this redox in, it's so much easier to get those signals. So our body does tell me, you know what? I need to have more balance. I need to do this, and calm myself down and not let this get to me. And so, I mean, redox is every aspect of every cell of our body. How exciting is that? And the fact that it's impossible for this not to work. I've heard you guys say that before. And then I've heard Dick Walker say it's the language of the cells. It's how they communicate. And it's so much energy and so many things happening so fast. And there is so much more information being sent through signaling than our brain talking to you, and so people just don't appreciate how wonderfully and fearfully we're made and how we all could benefit from more of this. A little something on the concussion. Last year, I did a study that took close to 9 months where I had 60 individuals that have never been on redox get brain mapped and then take 8 ounces a day for 90 days. And then they got remapped. And 55 people completed it out of the 60 that started it. And one of the things, a few of the people actually had concussions, a history of concussions. So I threw the concussion index. This is the software that military and professional sports use to see if you can play and be in the field. And so the black line was before they started Asea for 90 days. And they had in the yellow, no playing for this person. You have to be in the gray to play. And you can see anxiety was affected, language was affected, his moods were affected. And then the red is 90 days later, and the body was able to reverse all of that damage of oxidative stress and all of the inflammation that was just chronic in the brain. Now, I have a couple different softwares that we can do concussions with, and we can see the damage within minutes after the trauma, where an MRI, you need to wait days for the swelling to go down before you can get an accurate image of how much damage took place. And so it truly is an oxidative, excessive oxidative stress, like you said. And when we can put excessive molecules in to neutralize that, it's just going to happen faster. You can't overheal the body. It's not going to take more of what it needs. It's obviously going to need a lot more than we're ever giving it, most likely. So the minimum amount, even 4 ounces a day, we can see significantly changes the brain. Did I share that